So good evening, everyone. Hope everyone's doing well. And we'll get started with the first part of the presentation in just a second, which is going to be our COVID update. All right, so the first thing we're going to talk about is the weekly COVID-19 report that comes out from the Oakland County Health Department. There is one that came out probably about 30 minutes ago, but we're going to go with this one for right now. We weren't able to make that change. But a couple things we're noticing as far as trends, that in the lower age group, 0 to 4, 5 to 9, and 10 to 13, those numbers seem to be pretty much the same as the last report. Having peeked at the report today, those numbers in that age group are down. Now, talking to quite a few healthcare officials, they remind me that those numbers are down for potentially a couple different reasons. One could be lower because they are asymptomatic or have fewer symptoms, or because they're not quite traveling as much as the older students in older grades, or as adults where the case rate numbers are quite a bit higher. Next slide. So looking at hospitalizations from the last time we met, you can see they're right about 4,000. So we've seen a slight increase in the number of patients that have gone in since our last meeting, but we've seen a little bit of a dip when it comes to those that are critical at this time. Next slide. So looking at the 7-day rolling average of daily new confirmed COVID-19 cases, we've seen a little bit of dip. I know we've all watched the news and looked for updates. There is an anticipation or expectation that numbers potentially are going to go up because of Thanksgiving holiday, and if people were together during that time. Again, we'll keep track of that. These are daily, data points we check daily. Right now, we're starting to see the trend come down just a little bit. Next slide. Looking at Oakland County, and as far as what's going on in Oakland County, looking at two of our key indicators. One is new cases per 100,000. So we've started to see a dip there, a decrease. But then looking at the second indicator, percent positive, that data is basically the same as when we had our last meeting. Next slide. So the next two are dashboards that are put together by Brown University and the school superintendents and principal associations. And so this data continues to build from when it first started in August. There should be another update coming soon. So total number of students that are being tracked are over 3 million. And there are over 1.5 million students that are in school that are part of this data set, and over 537,000 staff that are in the building. Next slide. So we're part of this group that submits data as well. What we're really trying to do is see how often transmissions take place in school. So the data suggests right now that transmission in schools is lower than it is in the community in which schools are in. And it also keeps track of whether or not there's a school outbreak. And just for clarification, 2 or more cases with a link by place and time indicating a shared exposure outside of a household is considered a school outbreak. So it's not 10, 20, 30, 40. It's simply 2 that are considered an outbreak. So this is something, and you can kind of look at the number of participants as far as students and staff, which is going to be the graphic on the right. You can see the numbers were small early on as far as how many people were involved as far as submitting data, and that continues to go up. Next slide, please. Even though we are virtual, anytime we have a case that's reported to us of COVID, it automatically gets updated on our dashboard. So I've received a couple emails asking whether or not we're still keeping track of that data. We are. And so please submit so that we have that information and we can keep track. It is very helpful. Next slide, please. I shared this last time. MI COVID alert, a lot of states have put these in. It's just another way to keep track if you've been potentially exposed. Again, our goal is when we return to in-person learning to make sure we can mitigate exposure as much as possible. This app allows the user of the phone to know if they've been in close contact with someone that is COVID positive. So again, it's just another one of those opportunities to mitigate the transmission of COVID. Thank you, and that is it for our COVID update.